So the first question we looked at was, how costly are these patients? And first we looked at this from a relative perspective, looking at how concentrated is healthcare spending in the top 5% and the top 1% of the population. So what you see on this slide is in green, the top 1% of the population, orange, the top 2 to 5, and then blue is the bottom 95% of the population. The first question we looked at was, how costly are these patients? And first, we looked at relative spending. So how much of the total healthcare cost in a country are made by this top 5% or top 1% of the population? And what you see here, that in the Netherlands and Germany, the top 5% truly makes about 50% of healthcare cost. The green is the top 1% of the population and the orange is the top 2 to 5%. In Canada, we've seen that costs are slightly more concentrated, and in the US, they are slightly less concentrated. And in general, less concentrated cost means that costs are more equally spread across the total population. Or in this case, that in the US, the money is more evenly spent on the total population than, for example, in Canada. Then we looked at what is the actual spending. And there we see that high-cost patients in the top 5% are about 40 to 100% more expensive than high-cost patients in the Netherlands, Germany, and Canada, with an average patient costing about $40,000 in the USA and $20,000 in Canada. And in the top 1%, we see the same picture, just that those patients are on average about twice as expensive.